In this particular video, we're going to look at the treatments. And again, we're going to follow the treatments in line with the theoretical perspectives, because each theoretical perspective, because they see the anxiety disorder from a different point of view, so do the treatments line up with those different points of view. All right, so let's begin looking at treatment, and then we'll be completed this particular chapter. Good luck, everybody. Let's carry on. Each theoretical perspective is connected with methods of treating anxiety disorder, and we're going to look at them all. We're going to begin with psychodynamic. Traditional psychoanalysis helps people work through unconscious conflicts that are thought to underlie anxiety disorders. Now, more modern psychodynamic approaches also focus on currently disturbed relationships and encourage clients to assume more adaptive behavior. And they look at linking the past with the future and seeing how to circumvent that. Now, the humanistic approach, alternatively, these theorists suggest that our anxieties are a result from social repression of our true inner selves. Anxiety stems from the incongruence between the true inner self and the presenting social self. So in humanistic therapies, they aim to get in touch with the more genuine self, to know, accept, and be our authentic self, even if it is a pussycat and not the lion. The biological perspectives have spawned the development of various drugs to treat anxiety. Now, the antidepressants, well, they have an effect on anxiety in addition to depression by normalizing the activity of neurotransmitters in the brain. More recent success with serotonin norepinephrine reuptake inhibitor, the SNRI, has also been proven to be very effective. Obsessive compulsive disorder responds better to selective serotonin reuptake inhibitors, the SSRI, as it assists with the serotonin transmission, possibly responsible for the development of OSD. Drug therapy is not a one-size-fits-all, and it's often better in conjunction with cognitive therapies, and that's a good thing to link it with. You know, the biological puts you into a state where you're able to take advantage of the cognitive rethinking model. Now, the cognitive approaches, such as rational emotive therapy and cognitive therapy, help people identify and correct cognitive errors that give rise or maintain anxiety disorders. Cognitive behavioral approaches to the treatment of panic disorders help people with proneness to panic disorder to learn to cope with more effectively with cardiovascular and other bodily sensations. Now, learning-based approaches encompass a broad range of behavioral approaches and cognitive behavioral techniques to help people overcome anxiety-related problems. Exposure methods help people with phobias overcome fears of gradual exposure to phobic stimuli, a systematic desensitization, and organizing exposure using a fear-stimulus hierarchy, gradual exposure. Now, you'll find some of these on page 129 to 131. Now, obsessive compulsive disorder often is related to desensitizing and gradual exposure. There we go. Obsessive compulsive disorder is often treated with a combination of exposure and response prevention. Relaxation training is often used to help people with generalized anxiety learn skills of relaxation. And behavioral treatment for PTSD incorporates progressive exposure to trauma-related cues and training in stress management skills such as relaxation techniques. Behavioral treatment for social anxiety can be gradual exposure to less to more stressful social settings until the urge to escape subsides. This therapist will guide the client at first, and then the client learns to self-talk with more rational and healthier responses. The behavioral treatment to agoraphobia, it's gradual exposure and has had good and enduring success. Gradual exposure in agoraphobia will be getting into various steps and stages to getting outdoors and spending more time outdoors. That's gradual exposure. Behavior treatment of obsessive compulsive disorder, well, they incorporate gradual exposure and response prevention. The expression of effort to physically prevent the compulsive behavior from occurring, repeated, and has been minimized the anxiety associated with OCD. Now, the cognitive behavior treatment for generalized anxiety involves relaxation techniques and substitution of adaptive thoughts for the intrusive anxiety-inducing ones. And then catastrophization. This is where strategies are used to avoid thinking about the worst things that can happen. And so basically you're getting an overview of some treatment possibilities based on the different theoretical perspectives. Now, this last slide, we're just going to look at some general ways to use cognitive behavioral strategies to help yourself out of some general anxiety issues. Is first to deal with breathing. The 5-5-5 breathing strategy is to inhale to the count of 5, hold to the count of 5, exhale to the count of 5. That while you're doing that, you're distracting your mind from the anxiety-inducing situation by counting, and the breathing ensures that you get full lung capacity, full lung filled, hold, allowing your brains to be properly oxygenized, and this helps you better manage the anxiety. To use a paper bag to breathe into can be of benefit for many people. Talk yourself down. Use positive reaffirmation statements to remind yourself of your capabilities and your strengths. Try to relax, breathe, smile, look to gain social connections with people who help you and help you calm. Find someone to help you through the attack, whether it's a helpline or a friend. Don't become housebound. Get out and be engaged as much as you can. And if you're uncertain about any physical sensations, seek some medical support. Now, I hope this has been helpful. I've divided the videos down into 3 parts for each chapter in an effort to try to separate and shorten the videos up a little bit. I hope this has been helpful. So carry on the good work and good luck. I look forward to seeing you in week 5. Bye now.